an introduction. May I request Brigadier SHYAMSUNDAR to start the proceedings. Brigadier SHYAMSUNDAR, please.
Good morning, sir. Thank you for your kind words, sir. At the outset, I'd like to thank you for having included us as part of the IC. When I heard about directed ocular injuries, it brings to mind the various weapons that are used, or lasers that are used in day-to-day life, as well as industrial uses where lasers, as well as energy, which has been channeled into focus beams, are being used. When we have to define directed ocular injuries, we usually say these are electromagnetic energy or subatomic particles which are concentrated and which are focused on distant targets. And these, when you contrast them with traditional weapons, which basically rely on physical projectiles to deliver the payload, these directed energy weapons can utilize any of these forms, light, radio waves, or other energy forms. And delivery systems can be mounted on a variety of installations, right from aircraft, ships to fixed ones. And these sophisticated targeting mechanisms which precisely help direct the energy beam. Applications, if I put it broadly, is a military, medical, and industrial. And each of them have their own uses, right from counter-drone operations to defense uses and disabling the electronic systems of enemy vehicles to lasers which we use in LASIK, retinal disorders, and various other subspecialties, especially dermatology. Industrial, especially in welding, cutting, and material processing. If you go by the waves, right from the high power microwaves to millimeter waves and high energy lasers, the laser ones are used in a wide variety of uses, highly focused, and can cause ocular damage at significant distances, while microwaves are used for radar technology and even for active denial systems where you want to control crowds by using a heat source which causes this to make the patient, the crowd uncomfortable and move away from this place. Particle beams which can cause mechanical disruption to tissues upon impact. The origins of this, if you go to the Roman siege of Syracuse, when Archimedes used a series of mirrors to focus the light on ships, which used to cause fire to them and break off attacks, to World War II, where different DEW programs were used, mainly using X-rays and focus energies. Lasers were used for precision communications disruption, and a lot of this, what I told you about Archimedes, when he used these mirrors, set of mirrors to reflect light. And there was Mr. Rigsby who came up with the electric gun, which had electromagnetic waves to channel the forces. If you take examples of direct energy weapons now, right from what the US is using, the Tactical High Power Operational Responder or THOR, which can use these high electronic systems and microwaves to target multiple drones, lasers with integrated optical dazzlers and surveillance, which are used on ships and can cause disruption to sensors and potential to harm operators, and weapon systems which are deployed on naval vessels for targeting aerial vehicles. All these have an ocular hazard potential because they penetrate biological tissues, and the cornea and lens especially are vulnerable to thermal injury. Some of these weapon systems, which includes the lethal autonomous weapons also, the laws. And when we come to the phases, the 1970s were the ones where the lasers and magnetic weapons, electromagnetic weapons were used, and a lot of research was done. And after that, the phase of consolidation, and then the Iraq war where many of these were implemented. So when we come to the first phase, Mainly, there was funding to develop these weapons. There were some obstacles. Adaptive optics had to be improved. Beam controls and power generations had to be looked into. And in the phase of consolidation, the Department of Defense, the US, had acknowledged them as practical future weapons in 1999. And in 2000, the Joint Technology Office for High Energy Lasers facilitated collaboration among military branches to develop these weapon systems. And these in the Iraq war were used to disrupt communication networks, radar installations, and computer technology. Just a short brief on the mechanisms of injury, which can be mechanical effects due to the shock waves, the photochemicals due to the keratitis, and the thermal effects due to denaturation. As you can see in the figure, different UV rays and infrared rays that can cause right from sunburns to lens and retina injuries. And these can involve welding arc injuries, medical industrial lasers, as well as microwaves and nuclear blasts and arc welding. Even the laser pointers, there are a lot of work being done. They are usually supposed to be less than 5 milliwatts at the maximum. 1 milliwatt is what most use, but these can also cause macular burns if used in a very irresponsible manner. In just as when the atomic bombs were dropped at Hiroshima and Nagasaki, the radiation retinitis itself was a big issue at that time. And up to a month, these people had retinal manifestations with leukopenia. I will not go too deep into laser-induced ocular injuries. The next speaker will be speaking about them. Suffice to know that these themselves cause a lot of changes at the macular level and at the retinal injuries that they can cause, right from burns to dermat, where if the shields are not okay, you may end up with corneal injuries and retinal injuries. The Havana syndrome was about, again, electromagnetic radiation, where they felt that the US people in Cuba reported various symptoms, right from dizziness to cognitive difficulties, and they thought that this was due to radio frequency exposure. But it has been found that most of the time it's mass psychogenic issues that have caused these. And we also had retinal injuries after Op Parakram, where people had actually reversed their laser rangefinder and clicked and got macular burns. A lot of demonstrations which can occur where lasers can be used, so these have also been dispensed with in many demonstrations and gatherings. So far in Ukraine war also, they had some countermeasures. So treatment basically depends on cooling, anti-inflammatory, and protective patching when needed, and mechanical disruptions may require surgical intervention. So to conclude, the ophthalmic community must stay informed about these directed energy technologies to anticipate the energy patterns, and also to have educational initiatives to improve recognition and management, and as well as recommend a specialized registry for these injuries to better understand the injury and treatment outcomes. Thank you.
Thank you, Brig SHYAMSUNDAR. Excellent overview of and historical perspective of laser and directed energy